This is another edition of Indiana University Case of the Day, and today we're going to be talking about a combination ER and pediatrics case. I am Antonio Aguilera, a PGY5 radiology resident, and my staff joining here with me today is Sarah Lay. She's one of our outstanding combo ER and pediatrics staff. All educational content herein has been fully de-identified to protect patient privacy. So our case today is an adolescent with respiratory distress and an elevated D-dimer. So we have 4 images here. I'll give you a couple seconds to take a look and gather your thoughts. In our first image, we have a coronal plane CT on lung window. And here we can appreciate that there is extensive bilateral ground glass opacity involving all the lung zones. On our next image, we have an axial CT on lung windows at the level of the base of the lungs. And here we can better appreciate the confluent nature of the ground glass opacities. And note some areas of apparent subpleural sparing, as denoted by the arrows. On this axial soft tissue window, at the level of the AP window, we can appreciate bilateral hilar adenopathy. So just to provide some more helpful information, this patient's clinical and radiological course responded well to a short-term regimen of empiric antibiotic therapy as well as corticosteroids. The patient was discharged with a prednisone regimen as well as bronchodilators as needed, and she was also heavily advised to stop her recreational drug use so as to prevent similar bouts of lung injury. So kind of taking in all that information, both clinically and imaging wise, I'll give you a couple of seconds to gather your thoughts and come up with a diagnosis. Okay, so this was a vaping-induced lung injury. So now I will hand this over to Dr. Sarah Lay, where she's going to talk about her own experience with diagnosing this condition.
This is Sarah Lay taking over, and this indeed is a case of e-cigarette or vaping related or associated lung injury. We see this obviously with vaping related products with nicotine or cannabinoid products superimposed. I can say that more often than not in the cases that we're starting to see, these have been cannabinoid related. The incidence of e-cigarette users and how often this happens is quite unclear at this point. Several hundred cases have been reported, and I'm assuming this is underreported given that we have dozens of cases here at our institution already. The clinical presentation is indeed nonspecific and can range from purely respiratory complaints and also include vague constitutional or gastrointestinal complaints. The pulmonary manifestations radiographically or CT-wise do take a few weeks to show up, or in the more severe cases, we've seen them within days of starting use. The spectrum of findings that we've seen has primarily been bilateral ground glass opacities with a basilar predominance and subpleural sparing. The radiographs have been fairly underwhelming in most cases, at least initially. The ground glass opacities are quite vague on radiograph, however, more dramatic on CT. The most common pattern that we've seen has mimicked lipoid pneumonia, and the most common pathologic pattern that we have seen has also been lipoid pneumonia. However, cases have also shown features of acute eosinophilic pneumonia and diffuse alveolar damage or hemorrhage. As this is a relatively new diagnosis, there are proposed criteria and case definitions as per the American Public Health Authorities. You must have used e-cigarette or vaping or dabbing within 90 days prior to symptom onset. The pulmonary opacities must be present for the diagnosis, and there must be absence of pulmonary infection. So this is a diagnosis of exclusion. Key points to this: basically nonspecific clinically, but vaping must be present. The pulmonary opacities are usually diffuse bilateral ground glass opacities with or without subpleural sparing, and the patients all seem to have done much better with earlier onset of steroids. The number of case reports and deaths, especially in young adults and teenagers, is increasing, and as stated before, this is a diagnosis of exclusion.